Thank you for joining us for another episode on dental malpractice. In this episode, we'll be addressing this question. What if your dentist fails to diagnose oral cancer? A dentist's failure to detect or diagnose oral cancer that the dentist should have detected is grounds for a dental malpractice claim. And if the patient dies as a result, it's grounds for a wrongful death claim. If a dentist fails to diagnose a patient's oral cancer, the cancer often progresses and becomes much more serious than it would have if the dentist caught it earlier. Now, we're about to talk about some of the more common consequences of a dentist failing to properly diagnose or detect oral cancer.
Number 1, expensive medical bills. The cost of surgical treatments, radiation, and chemotherapy treatment can be very expensive. Oftentimes, if the patient's oral cancer is detected early, the patient will need less treatment than if the oral cancer is detected later. Therefore, a dentist's failure to detect and diagnose oral cancer can lead to more expensive treatment.
Number 2, pain and suffering. Treatment for oral cancer, just like other forms of cancer, brings about horrific side effects, including difficulty swallowing, difficulty eating, tooth decay, fatigue, loss of hair, nausea, and vomiting. These terrible symptoms can interfere with one's ability to live, to work, and to enjoy life.
Number 3, the spreading of cancer. According to the American Cancer Society, a person is more likely to survive oral cancer if the cancer is diagnosed at an earlier stage. If the cancer is localized, meaning it has not spread beyond the organ where it started, the survival rate is much higher than if the cancer spreads to nearby structures or lymph nodes. Once the cancer spreads, the survival rate drastically decreases.
Number 4, wrongful death. Just as the name suggests, wrongful death is a death that should not have occurred but for somebody's wrongful or negligent act or omission. Oral cancer has a high mortality rate. In other words, oral cancer kills people. According to the American Cancer Society, there are roughly 11,000 deaths from oral cancer each year. Unfortunately, many of the deaths could have been prevented with early diagnosis and treatment.